Welcome to Zoom In, Zoom Out. I'm Alec MacDonald.
And I'm Isabel Wang. So every May, Geneva gets really busy with politicians and health professionals flying from around the world for the annual World Health Assembly.
And although Taiwan was once again excluded from the assembly, that did not stop the country from hosting its first ever Health Tech Expo.
So we're here for a week to find out what's happening on the ground.
This exoskeleton is just one of many medical innovations that Taiwan is showcasing at its first ever Health Tech Expo here in Geneva. It is part of the country's wider efforts to showcase that Taiwan can not only help, but that it is already helping.
We provide an AI-driven exoskeleton solution, and we use the solution to help the hospital and the long-term care center to expand the capacity for the rehabilitation, for the long-term care, so we can help the patient to regain the ability sooner.
The Taiwan Smart Medical and Health Tech Expo featured 30 Taiwanese healthcare institutions and enterprises, specializing in next-generation AI solutions and award-winning technologies.
We came here to show that what we are doing in Taiwan and what we can contribute to the world. And I think that is important because, WHA is forbidden us to join the conference. And we think that we actually have the capability to contribute to the healthcare in the world. Yeah.
The three-day expo brought together healthcare leaders to discuss the responsible use of AI in the sector, with some saying it's a chance for Taiwan to expand business opportunities in Europe.
Taiwan has been doing business with Europe, and European businesses have been doing business with Taiwan for the past decades, many decades. This is ongoing improvement of business relationships with both suppliers, distributors, manufacturers on both sides. We see the same in healthcare, in AI.
I think it's important that we develop AI that has an added benefit to the hospital staff, so it ends up being used. There's no use in an accurate tool that does what doctors are already doing and doesn't even save them any time. I also think it needs to be tested well in clinical practice, and it shouldn't disrupt the workflow of clinicians but add to it. So to me, an optimal AI tool needs to integrate with the workflow of clinicians and chime in at the right time to help physicians and nursing staff rather than interrupting them.
With the AI, we can predict more. We can have any advanced prediction. For example, we have an AI algorithm to forecast your 6-year lung cancer risk. And we have an ECG algorithm to tell you whether you are going to die within 90 days. That's creepy, right? But this is some kind of AI tools to help the clinician, help the doctors to make certain decisions. For example, if your lung cancer risk is high, you can increase the frequency of the CT test.
We want to bring the technology here to help the patient in European region. For example, for Ukraine, we know the situation, so we sure the technology can help many patients.
I think we saw a strong signal of Taiwan as an innovative country that can contribute to global health and innovation. So I was impressed seeing the display yesterday with the Minister of Health and the Minister of Foreign Affairs.
However, Taiwan's exclusion from the WHO does not only affect this generation of leaders. We caught up with a student delegation from the Taiwan Healthcare Youth Alliance who hosted and attended sideline events during the WHA. What does meaningful participation in global health discussions look like, especially from a Taiwanese youth perspective?
I think we have to define first what is meaningful participation. So from a Taiwanese youth perspective, we can see that there are a lot of youth, or let's say young students, they're really eager to join in these conversations. But the thing is, for them to turn all these conversations into action, this part is missing because we are not being invited to all the official side events, or let's say all the official campaigns or activities. For our association, we try to establish this platform for all young people and also youth because we wanted to bridge this gap between just words and actions.
How would joining or not being able to join WHA, WHO events affect your career path as a Taiwanese youth?
I think for all youth, or let's say the ones who is going to, trying to step into the world and trying to look for their first job, validation is the most important thing. If we were not able, we are not able to join into all these official sites, the validation could be a problem because we have so many passion. We do so many things. We advocate for a lot of things.
Shay Liu also joined this year's student delegation. She says the chance to speak on the sidelines of the WHA is giving her first-hand exposure to the latest trends and challenges in global health.
I feel like the other people from other countries, they have abundant resources, and so many senior experts will lead them into this world. But for us, for the Taiwanese young professional, we are hard to find the ways to enter into the global health affairs and develop our career. This is what our organization wants to do. We want to create the meaningful participants and the sustainable platform for the younger generations to build the strong concept about the global health for them.
So far here during your time in Geneva, what conversations have you had with local experts that you have found interesting?
Yesterday we just finished our conference. We were talking about the ethic and the sustainable issues on digital health. So one of the experts just reflects to me that she's really interested in how young professionals can contribute to ethical issues. It is hard to imagine the young professional can really make a change on this topic. But my response is, although young professional is not the major role, doesn't play the major role in these systems, but we can bring the concept into the younger generation.
Politicians and policymakers, they need to deal with things that are happening all the time, and we have been living in a time of permanent crisis.
So when the World Health Assembly kicks off in Geneva, official and unofficial side events like this taking place across the city. One of the focus this year is about how climate and health discussions can be taken from political agenda to an actual real-world implementations. That's why we're seeing political leaders and experts are gathering here to call for immediate action.
I have been following this debate for many, many years.
The newly launched Pan-European Commission on Climate and Health is chaired by former Icelandic Prime Minister Katrín Jakobsdóttir, as the European region is at the center of climate-driven health risks.
The climate crisis is a different crisis from the pandemics as we know them. It's because it's a systematic long-term crisis. But that's why this commission has actually assembled the evidence. We have assembled the facts and the data.
We are very keen to see climate change integrated into health policy and health integrated into climate policy. And the reason that that is so essential is that you come out with different policy solutions if you're actually taking both of these into account together. Some of the solutions that we can take for climate change can be very beneficial for health, or in some cases can be harmful for health or can ignore the harms to health. And so you need to take health into account as you're making those decisions.
What we see that there is a huge health risks that comes with climate change, both because, as you say, heat waves, droughts, floods, but also because climate change is causing a threat to our food systems, our water supply, etc. We're already seeing the consequences of it in our times and in our days. So it's not just in the future, it's happening now.
Climate change has been dropping on the political agenda, losing status as a priority issue that needs to be addressed. And we're losing time. Something like this commission that gathers the evidence, that brings together very serious commissioners to consider that evidence, and that looks not only at the impacts, but also at potential solutions.
We have these very clear 17 recommendations, some of them for health ministers, some of them for governments, some of them for WHO, and some of them also for local communities. And I think actually policymakers can take those recommendations and they can use them for the greater good of their citizens.
Our organization works to also enable health organizations and health professionals to talk about what we're seeing in the clinics and communities that we work in, because people connect with what's impacting their own health.
Even though Europe is the fastest warming region, it's still happening everywhere. So what we say is, if we can share our knowledge, share our thoughts, share our ideas, I think all the regions need to really look at it and see what they can do.
Our hope is that through bringing forward the conversation from a health perspective, it kind of depolarizes the situation a bit, and people can see, no, this is really about me, my family, my community, and becomes more open to taking those actions that we really absolutely have to take at this time.
Climate change is not the only focus, however. We're also hearing major concerns over declining public trust, massive financial shortfalls, and lack of health system capacity.
We're here at the World Health Assembly in Geneva, and we're battling with two really rare viruses, hantavirus and Ebola virus, both strains of the virus that we've not seen. And so in real time, what we see are pandemic risks all around us, and yet the world is, far from prepared. We've responded to both outbreaks as if we never learned anything from COVID. We've lost capacity for surveillance, everything around us in terms of public trust, financing, health system capacities. It's all weaker now than it's ever been when the risks are greater than they've ever been.
Like a country like the United States withdrew from the WHO last year, and the funding, the financial issue is one of the very hot topics people really care about. And also the AI and the digital health is another hot topic for many people, many countries, because how this technology has already transformed not only civil society and the government and the humankind in general, and how this AI technology can also has an impact on the healthcare and global health as well. Rule of law is the foundation for public health. Without this kind of foundation, a lot of public health measures like quarantine, isolation, and vaccination cannot be done by the government and to people. So rule of law is a very fundamental and a critical, essential part of the public health.
We are going through an information crisis for many reasons. Social media, amplified by generative artificial intelligence, send out reams of false and misleading information about health. The current Director General, Tedros, is a very close friend of mine, but he's been politicized, caught between China and the United States and other, populist governments. But I think he's done a good job. I think the next Director General is going to have to try to bring in the United States and other countries back into WHO. The next Director General is going to have to make sure that the organization is well financed, and it's going to have to make sure that it's WHO is less bureaucratic and more able to respond quickly to global health emergencies.
Thank you for watching this special episode of Zoom In, Zoom Out, reporting from Geneva.
Which part of today's conversation that you find most insightful? Leave a comment below and let us know. Also, don't forget to like, subscribe, and share. Thanks for joining. Until next time.